Reasons why Medicaid expansion, I think, is an extremely dangerous path to be going down. Without kind of hearkening too much on the healthcare outcomes, I think most of you guys have probably seen a lot of these numbers. For various diseases, various ailments, people on Medicaid have worse health outcomes, far worse than people on private insurance, and often worse than people with no insurance at all. And the biggest reason for that, which I'm sure everyone in here is familiar with, is the low doctor reimbursement rates for Medicaid. So across the country, it's getting more and more difficult for Medicaid patients to access a doctor, get regular appointments, get quality care that they need, which honestly is a tragedy, just given, one, who Medicaid is meant to serve, and two, how much we pay for it. We know what the health outcomes were like without the Medicaid expansion. You're now adding thousands of childless, able-bodied, working-age adults to this population, not adding a single doctor. I mean, it's a pretty simple supply and demand. And two, how much we pay for it. It will soon eclipse $500 billion here in the next 5 or 10 years. One of the primary drivers of our national debt, which I think too often gets ignored at the state level, but Washington politicians at least kind of pay lip service to that. But Tennessee had an expansion a few years ago that I think back in 2005 had at that point crowded out. It was taking up 1/3 of their entire state budget. A Democrat governor had to repeal that entire expansion, throwing tens of thousands of people off that program. There was that. There was, in the state of Arizona, they passed a bill in the year 2000 that kind of gradually expanded their Medicaid eligible population. And it was another perfect example that they had estimated in the year 2000 it was going to cost $389 million. That ballooned to $1.6 billion, obviously leaving state taxpayers on the hook. And we've seen that problem occur in states across the country. But what we hadn't had, because the law was so new, Obamacare was so new, was Medicaid expansions under Obamacare, which we now have evidence to go back in states of all different political stripes, all different sort of stripes of expansion that states have done. So I just want to walk through a couple of those, profiled 4 or 5 states here. The first one I pointed to is my home state of Rhode Island. Obviously, few, if any, similarities to Missouri, but has been a state that, being so progressive, has prided itself on this, embrace of the welfare state, if you will. Their spending on Medicaid increased by $1 billion since 2013 when they chose to expand Medicaid. It's $118 million over budget this year, and it'll take up nearly 1/3 of the state's entire budget. That's $8.8 billion. So what that means, and what that means in all these other states, is that means unless they want to raise taxes or kick people off the program or start cutting benefits, that means less money for roads, schools, public safety, all the other priorities that government has to fund. And I know there's a gas tax debate going on here. That's just one example in a blue state. We had a Democrat governor elected last fall who prided herself on being sort of a fiscally responsible Democrat. She got through as the treasurer some pretty impressive pension reform and that kind of thing. Her first proposal, she comes in and says we have to cut $80 million from the Medicaid system. So these are sort of inevitable consequences of expanding a program like this to able-bodied, childless, working-age adults. That's one example. The next one we walked through, Illinois, right? Same kind of thing. They estimated it was going to cost $573 million from 2017 to 2020 when the state's funding portion of it kicked in. As you know, the federal government promises to cover 100% through 2016 of the expansion population and then gradually pare it down to 90%. So through 2017 to 2020, they estimated $573 million. Because enrollment far exceeded what they had imagined, what left-wing groups, right-of-center groups, the government itself, they're now estimating it's going to cost $2 billion in just those 3 years. Same problem. That's going to mean higher taxes, either funding cuts or a combination of both to roads, schools, public safety, and whatnot. And the way Governor Rauner put it, who we earlier described, he's like a bull in a china shop. He's not afraid to come in and kind of stir the pot. So he said this could end up being a problem worse than their pension problem, which we know is far and away the worst in the country. One of the other ones we touched on in here, and I'll just run through this quickly, was Arkansas. Arkansas, as you guys probably know, passed their private option, which they like to coin their conservative expansion. It had all these like sort of bells and whistles and window dressing that made it not a Medicaid expansion. It wasn't Obamacare, wasn't this, wasn't that. Most important thing to note is The Obama administration gave them almost nothing they asked for in that private option expansion. They'll never agree to a work requirement, and that's because in a lot of poorer states, if you're working full-time at minimum wage, you're actually no longer eligible for the Medicaid expansion, so it doesn't actually even make sense for them to allow that. And the thing is, every time they do one of those, it's going to be a concession, whether they do it in Pennsylvania, they did it in Iowa, Indiana, Arkansas again. So same kind of thing. They started throwing these people onto private insurance plans. Those private insurance plans are almost twice as expensive as a normal Medicaid expansion. So you're now running into the same problem where you're putting able-bodied, childless, working-age adults on taxpayer-funded health care, but it's costing taxpayers even more than it would have otherwise. Is beyond the budget numbers. What that essentially means is you're now putting those able-bodied, working-age, childless adults in front of the line of everybody else who's on the Medicaid program, because everybody who's already on Medicaid has the normal federal match rate, whether it's 50% here or 30% or whatever. That expansion population is the only population that gets the 90% federal match rate. Does that make sense? So, that is essentially, you're putting them in the front of the line beyond people for whom the program is actually intended, so that when the inevitable happens and the state has to start making cuts to save money, it's going to be easier to start cutting back on that more vulnerable population because the federal government is picking up more of the tab for the able-bodied, childless, working-age adult expansion population. This issue is a perfect example of one of those issues where the other side can take what they believe and put it on a bumper sticker or put it in 140 characters, and they can go out and sell it to people. Whereas our side, you start talking about budget numbers and healthcare outcomes and crowd out and this and that. It's a much tougher sell to make, but it's obviously an equally important sell.